The views expressed in this program do not necessarily reflect those of this station.
Welcome to Insights into Northeast Michigan, a WBKB News public affairs program. Insights deals with the issues affecting those in the community as well as Northeast Michigan and the state. And now, Insights into Northeast Michigan.
Welcome to Insights. I'm Sherry Stewart. Today we're focusing our conversation on programs and services that help our seniors live their best life. And joining me to kick off that conversation today is Julie Robinette. She is a MAP counselor with the Senior Center of Alpena.
Correct.
All right, with the Alpena Senior Center, I should say
You got
correctly.
it.
And so MAP is the Medicare, Medicaid Assistance Program.
Yes, it
and
is.
so we know that sometimes seniors have a lot of questions about that. Just recently, you guys had one of your monthly workshops with that. And so tell me a little bit, Julie, about why people may need to sign up for Medicare. Let's just start there.
Well, we do a new to Medicare workshop once a month. People that are new to Medicare, it could be because they're turning 65. They might be older than 65, but they're leaving their job, and so now they need to sign up. They could have been disabled and now they're changing to Medicare. So there's a number of reasons why they're new to Medicare. And what we do in the workshop is go through when they need to enroll, how they need to enroll, and where they can get assistance with that. And we also go over a lot of things that Medicare covers. Benefits, prescription coverage, and there's a number of options available when you join Medicare that you need to make an informed decision, because once you sign up, you can't change until the next open enrollment.
Which is that a year from
Open enrollment is October 15th through December 7th every year.
Okay.
And that's an opportunity to make changes to your prescription drug plan, your Medicare Advantage plan, those types of things.
So those are, as you say, very important decisions that you want to be informed
Oh, yeah.
about before you make those decisions.
Right.
Now, what are some of the questions that you're finding that people are having when they come to your monthly workshop?
Well, typically they're just not real familiar with what to do. They may have gotten their Medicare card, but then it's, wow, what do I do after this? So we go through and explain what the options are and assist them with that.
Now, do the people do you have to be technologically savvy? You know, pretty much everything is online. Are there paper enrollments? How do people actually get enrolled now?
You can, Part B, Medicare, you can sign up through Social Security. You'll get your card automatically if you're already collecting Social Security when you turn 65. So there's a number of ways to sign up. You can do paper applications. There is online, Medicare.gov. Like you say, if you're not real savvy, people aren't going to be comfortable doing that, so that's where they'll come in and we'll assist them with that.
And this workshop is free.
Oh, correct.
Every month it's free.
Free, yep. You got it.
And I believe you were telling me, I think the last one you had, over 100 people come in or so? You were really busy.
No, there were 13.
Oh, 13.
That was the exercise class.
Well, there's lots of things happening at the Senior Center apparently, but let's go back to the Medicare, Medicaid, that enrollment.
Yeah.
So you're helping these people with hands-on information, hands-on assistance.
Right. We do a PowerPoint presentation, and we have MAP volunteers that come in to help. So then after the presentation, we will meet with them individually.
Okay.
Because everyone's situation's different.
Oh, sure.
There's just various things to consider.
Sure. What are some of the changes to the drug programs? Can you tell us a little bit about that? What are some of the things that people can now consider?
Well, the drug programs, we recommend that you review it every year during open enrollment, because companies change how they cover things.
Right.
Your medications may change. One company may cover it different than what you had. So it's always a good idea to look at that every year.
And how long does the enrollment process? Are you immediately, once you enrolled, is there a wait time? What happens after you, say somebody comes to your workshop and they enroll, what happens? What's the next step?
Well, it depends. When they're turning 65, once they enroll in Medicare A and B, it's always effective the first of a month.
Okay.
So it depends when your Medicare A and B is effective. Then you look at the other things that you need to do. If you're going to sign up for a Medicare Advantage plan or a Medigap policy, a prescription plan. There's various time frames for those things.
And what are other questions that you see that people may not be very knowledgeable about or feel a little bit discomfort? They need a little bit more education about this whole process.
A lot of it's just they want to make sure they're doing the right thing because
Yeah.
it can be a costly mistake
Yeah.
if you make an uninformed decision. A lot of the other questions we get as MAP counselors are people that maybe throughout the year they get new prescriptions and they're very expensive.
Yeah.
They'll come in and we'll review that with them. And there are some assistance programs that can help them, even though it might be in between open enrollment.
So they can still get that assistance in between.
Sure.
What are some of those programs? Can you share some of those programs?
There's some manufacturers assistance programs.
Okay.
There's some plans if you're based on income where you can get extra help with your premiums. So we do screening to determine if our beneficiaries
And you
are
do all that here at the Alpena Center?
Yeah, when I talk to a beneficiary, that's one of the things we want to make sure we verify income to see if they're eligible for some subsidies and extra help.
Okay. And again, as you say, some of those programs are income-based.
Correct.
Okay.
Correct.
Okay. And any other questions or concerns that you see pretty frequently as they come into your workshop?
A lot of questions just on Medicare billing.
Right.
We'll answer those. A lot of prescription questions because prescriptions are so expensive
They are
for
so
our
expensive.
seniors.
Absolutely.
And even if your income is very high, you don't really want to pay that if you don't have to.
Right.
So a lot of prescription questions, Medicare billing, general Medicare questions we help people out with.
And so are there any times of the year that you're busier than other times of the year? I know obviously open enrollment, but any other times of year that you're really busy helping the
It
seniors?
kind of goes in waves. I mean, like for our workshops, we'll have 20 people one month and then maybe a few the next, so it just depends. But it seems to be pretty steady throughout the year. We schedule appointments for people to come in throughout the year. And then open enrollment. Last fall, I think we had 4 or 5 volunteers that helped, and we probably talked to over 600 people last fall.
Wow, that's pretty steady.
Yeah.
Absolutely. So do we have to pre-register for the free workshop? We just come in?
We prefer that you call.
Okay.
And so we know how many to set up for.
And do you have a date already selected for your one for next
March 12th.
March 12th.
At 1 o'clock.
Okay, here
And
at the
then-
Alpena Senior Center.
Correct.
All right.
And the newsletter that the Senior Center puts out every month, they will have it in there for every month.
All right. Well, I want to thank you, Julie, for helping
All right.
us kick
Thanks,
off
Sherry.
this conversation about seniors and what is happening here in Alpena to help them live their best life. And we'll have a little bit more of insights right after this. Well, welcome back to Insights, and we are picking up our conversation on our area seniors and the programs and services available to help them live their best life. And joining me to carry on that conversation is Lori Sauer. She is the director of Region 9, the Area Agency on Aging. So welcome, Lori.
Well, thank you.
And we've got a lot to talk about because your services help seniors in 12 counties.
That's correct.
So that's a lot of work, a lot of seniors being helped.
It is. So it's a large area, but there's a large need. So rural populations are a little different than the urban area, so we
Yeah.
cover a little more ground because of the population base.
So tell me about some of the programs and services that you do have available that people can partake of.
Sure. We have a number of very valuable programs that can help seniors. The ones that are of most interest are the ones to help them stay in their homes for as long as possible.
But that's really important because people like independence.
Absolutely. So that's what we try to do, whether it's through our evidence-based disease prevention, health promotion programs, or through our actual in-home service programs. We do try to keep them independent and living in their desired setting for as long as possible.
And that, again, is so important because it also helps extended family members as well, I believe, too.
Absolutely. We do have a number of caregiver programs, too, for those folks who are caring for a loved one.
And tell me a little bit about those.
Well, we have some evidence-based classes that can help people prepare for those transitions in life when they're becoming an active caregiver or if they're already in that situation. So we have a Creating Confident Caregivers series of classes that help people who are caring for a loved one with dementia. We also have our Powerful Tools for Caregiver classes. That's a more general caregiver type of course that can help them. But we do have a new service that we started this past year. It's an in-home dementia consultation where we have a staff person that goes out and talks about the special challenges for folks dealing with dementia in the home, and can provide some tools and techniques that can help them and get them in touch with some resources that can help as well.
Have you had a lot of people reaching out for that new service?
Not as many as we would like, but it is growing.
Okay,
Yeah.
as more people learn
More people
about it.
learn about it,
Yeah,
correct.
Okay, all right. What about some of the other services? I see you have you said creating confident caregivers.
Correct.
So people want to feel confident if they have to be in a position to give
Right,
care
right.
to their family members.
Right, so that program will help them understand the changes that are happening in their loved one's life due to the dementia. Again, it will provide them with special techniques to address the challenges with dementia. There can be behavioral challenges, and as the disease progresses, there are a need for other services, so we give them some resources to help them seek those out, or we can make referrals for them as well.
Very good. So are there certain times a year where you find yourself busier than others? Is it more in the wintertime, or as the temperatures get warmer, people are more likely to reach out to you for your services? What do you find?
You know, actually, we're pretty steadily busy all year round.
Okay.
Yeah, it just depends where people are in their life situations right now as to when they start needing these services. Obviously, if they're having chronic disease issues, you know, an escalation of their symptoms or the disease process, they'll need more assistance in the home. So it really just depends. When family members come home and they notice mom and dad aren't really doing as well as they say they are, we get a lot of phone calls then as well.
Okay. And what does it take for people to partake of the services, to benefit from them? Say you may be a senior yourself or a family member. Do they just call? What is there a process that they need to go through to reach
Absolutely.
you?
They can just give us a call. We do have a link on our website that they can send an email that way as well. And there's a referral form also on our website they could fill out. So there's a variety of different ways to make the connections.
Okay. And I see here there's another program, the Foster Grandparent Senior Companion Volunteer Program. That sounds like a lot of fun.
It is. And our Retired Senior Volunteer Program as well. These are all 3 senior volunteer programs where they can contribute back to their community. Obviously, with the foster grandparent program, they're working one-on-one with children,
Sure.
whether it's in a school setting, a Head Start center, youth programs, those types of things. Senior companions work one-on-one with their peers, so senior to senior, just like it says, companionship, providing that visiting component, that connection. You know, isolation is a huge risk factor in terms of nursing facility placement later in years. So if we can keep them socially connected to their community, they have a better quality of life. And that's not just for the volunteer, that's also for the person that they're working with.
Oh yeah, it's all about that community connection,
is.
and that you're able to provide opportunities for people
Right.
to be connected so that they can, as we've been saying in this segment, is to live their best life.
Right.
And we want our seniors to certainly have opportunities to do that.
Right, and then with our RSVP program, it's not as structured necessarily as the senior companion or foster grandparent programs. They have opportunity for a variety of different volunteer activities in the community.
Oh, that's excellent.
Yeah,
There's lots of
Lots of
opportunities to
things
get
to do.
out and explore and meet new
Right.
people and stay connected.
Yes.
And certainly here I see there's long-term care ombudsman. Tell me a little bit about that one.
correct. We have a licensed social worker who covers our region,
Okay.
visiting all of the nursing homes. There are 21 nursing homes in their 12 counties. And she is there basically to help those nursing facility residents resolve problems they may have in the nursing homes. She is their advocate. She works to resolve any complaints they might have, protecting their rights as a nursing home resident, provides education to the facility and their staff. So it's a really, really nice program.
Absolutely, because
She's
we
a very
all need
busy
somebody,
person, right.
somebody to advocate for us. Certainly if you're
Absolutely.
a senior, sometimes you may be living away from family, but
Right.
to have an advocate like that is really
Right.
important.
Yes.
And I see another program here, care management. Is it My Choice?
My Choice?
My Choice? Okay.
Yes. My Choice is basically an in-home program that provides an alternative to nursing home care. So they do have to meet some pretty stringent guidelines
Okay.
and, with the Medicaid program and level of care needs. But it's a great way to keep someone home, providing similar types of care that they would receive in a nursing home. They do have to meet that level of care. The care management, it's a similar type of program, but they don't have to qualify for Medicaid.
Okay.
My choice is open to individuals 18 and older
Okay.
who have a disability or a need for that type of service. Care management is for your older adults, and there is no
Okay.
income guideline for that program.
Okay, so there's lots of
Lots of
opportunity.
options,
Yeah, lots
right.
of options there.
Yes,
All right,
absolutely.
very much so. Well, this is just fantastic. So many programs
Lots of
covering 12
programs.
counties.
Absolutely.
Area Agency on Aging, Region 9.
Correct.
So you guys are some busy people helping our seniors live their best life. So I want to thank you
Yes.
today, Lori, for joining me to tell us about these programs. Is there a phone number that you want to share with us so that if people need to call and,
Sure.
and take advantage of the services,
Yes.
who should they call or what number should they call?
It would be 989-358-4600, or we also have an 800 number,
Okay.
which is 800-219-2273.
Okay, all right. Well, when we come back after the break, Lori, we're going to talk about some of the upcoming programs that you have.
Great.
You're watching Insights, and we'll be back right after this. Welcome back. We're continuing our conversation about our seniors and the programs and services to help them live their best life. Joining me again today is Lori Sauer, and you have some upcoming programs here at the Area Agency on Agency, so let's talk about that.
Great. Yes, actually, these are in some of the communities that we serve.
Okay.
So just a few of the classes that are coming up. One of our more popular ones is A Matter of Balance, which is
Okay.
a fall prevention program.
Oh, that's really important.
It's very important,
Yeah, so
especially
you've got
for
one
older
wing
adults.
here
Yes,
today.
one wing. So we have that class starting on Fridays, May
Okay.
1st through June 19th
Okay.
at the Mount Morency County Commission on Aging.
Okay.
And folks can register with that office, or they can contact us as well. We also have Powerful Tools for Caregivers starting in May at the Alcona County Commission on Aging, and in August at the Iosco County Commission on Aging.
Okay.
Creating Confident Caregivers will be in Presqu'île starting in May on Tuesdays. And those are the ones that are really in the immediate area. We have some other classes going on in some of our outer counties, but those are the ones that are closest to Alpena.
Okay, okay. And people just register. Do they call to register, or should they? How do they get information
Correct, yes.
to register on
They
those?
can
Okay.
call to get registered for those
Okay.
programs, like I said, either with the Commission on Aging
Sure.
or with our office here as well.
Now, are you finding programs that people are that they are more popular than others? What are you seeing as really the need, where people are really
Yeah.
reaching out to you for this one
Right.
or couple of
Right.
particular things?
The Matter of Balance has been really
Yeah.
popular because of the risk for falls,
Yeah.
especially in our area with the icy
Yeah.
roadways, sidewalks, et cetera, around the home. So that is a real important one for older adults who sometimes have some issues with balance
Sure.
as we get older. The Powerful Tools and the Creating Confident Caregivers, those have also been popular again because the number of caregivers are growing due to the aging population. So those have been very popular, especially Creating Confident Caregivers because it addresses that whole dementia issue, which is a very challenging situation for folks.
So, yeah, I would imagine. And then if people don't anticipate that they may have to take care of a loved one that has dementia. Sometimes I've heard that it takes a while before you even really recognize that the
Absolutely.
signs are there.
Right, absolutely.
And so by the time you're deep in it, you really don't know where to go, what to do,
Right.
because you hadn't anticipated it.
Right, so it's best to get the information as early as possible. So once you start noticing some of those changes, we can get you into a class and learn more about it. Another popular program that we have, and I think you've heard a little bit about it, is our Medicare Medicaid Assistance Program,
Yeah.
and that's really important.
Right.
Everybody knows how complicated our Medicare and Medicaid systems are, and we have trained counselors that can work one-on-one with people so that they can choose the right health plans, understand their benefits, get general information, or resolve problems with their medical providers or whatever it might be related to billing. So that's another really helpful program.
I'm sure that's very helpful and
Right.
very needed and informative.
Correct.
because there's a lot of questions, certainly when it comes to prescriptions and things of that nature that go along with your Medicare coverage. So.
Yes, very complicated. And one we didn't mention yet was legal services.
Oh, yeah.
We have a small budget to provide some free legal services for older adults needing some help with some of the simpler things. So maybe a simple will, a landlord dispute,
Sure.
setting up a guardianship or something like that. That's another very valuable program for our region.
Yeah, and then being able to understand, because legal documents can be a little bit intimidating.
Absolutely.
Some of the jargon, or I should say the language, it may not be what we use every day in
Right.
everyday conversations, so it can be a little bit challenging for people to understand. So it's great that you guys provide that service.
Yes.
Now, is there a cost for that, for the legal service?
There
or-
is not.
Okay,
No,
that's wonderful.
there isn't.
So they just call the Area Agency on Aging.
Well, they would call Legal Services
Legal
of Northern
Services.
Michigan.
Okay.
Right. We provide some of their funding for that
Okay.
services, and they do have an office here in Alpena, so that's very helpful.
Okay, so just to talk a little bit about the history of the agency. So how long have you been here? You're serving 12 counties, so that's a lot of
12
work.
counties,
So you've been here for a long time.
Yeah. Over 30 years.
my.
Yeah, the Area Agency on Aging has been in existence. Started way back in President Johnson's day, the War on Poverty.
Okay, yeah.
Established the Older Americans Act, which funds a lot of our programs. And of course, Michigan also has the Older Michiganians Act, which also provides some funding to support these programs. So we've been around for a long time. We do a lot in terms of planning for services, looking at what types of things are needed in our communities, and then seeking out those programs for funding and implementing them in all of our communities.
And so with your history here, what have you seen that's been maybe the most surprising as you've continued to do this work and the agency has been around for such a long time?
Yeah, probably the most significant thing that we see is people don't know we're here. So we really want to get the word out
Absolutely.
that they do have support, and they just need to give us a call.
And they don't have to age alone. There's so many wonderful
Correct.
programs and services that can help
Absolutely.
them,
Yes.
as I keep saying, live your best life.
Exactly. Yes, if you're not certain about something, call us. There are area agencies on aging across the state, so no matter where you are, there is someone that can help you answer those questions.
Now, are you all linked across the state, or is it all one umbrella, or do you operate independently, or how does that work?
They're all independent
Okay.
agencies, right. I mean, we all receive funding under
Okay.
the Older Americans Act, but
Sure.
they're all individual entities.
Okay.
There are 16 in
Okay.
Michigan.
All right, all right. And this must be one of the larger ones, covering 12 counties
We
here.
are the second largest.
Oh, you are?
Yes.
Oh, my.
The
Okay.
Upper Peninsula
Uh-huh.
covers 15 counties.
Okay, okay. That's a lot of work, but there's a huge senior population, and apparently it's
There
growing.
is.
So
It is,
being
yes.
able to provide services for them is certainly truly important.
Yes, and we have a lot of wonderful community organizations that partner with us to provide these services and programs, so we're very thankful to that as well.
Oh, good to hear it, good to hear it. Well, Lori, I want to thank you for being my guest today to share with me all the wonderful programs and services that you have for our area seniors and their family members too, so that they can get some information and knowledge too to help their loved ones to live their best life as area seniors. So thank you.
Yes, thank you.
Well, this has been Insights. I'm Sherry Stewart, and thank you for watching.
Insights into Northeast Michigan is produced by WBKB News. If you have any comments, suggestions, or topics you would like to see on a future show, please email WBKB News. This has been a production of Thunder Bay Broadcasting Corporation. All rights reserved.